area. Very slow on the A40 westbound to the West End Road junction at South Ruislip. That's following an accident. Still only one lane open and there are delays all the way back to the Target roundabout at Northolt. Two problems on the North Circular Road. Firstly, westbound queues to the A10 at Edmonton, and that's because a lorry's broken down, and only one lane's open on the North Circular Road southbound at the A12 junction, and that's following an accident and there are queues on the approach.
LBC
in Yorkshire.
Ferrari now 0345 6060 973 LBC.
How you feel.
Nick Ferrari at breakfast on LBC. Call 0345 6060 973.
Just to remind you, of course, later in the show, with so many questions about vaccines and vaccinations, we have the Deputy Chair of the JCVI here taking your questions. That's from 9, just to flag that up for you. And on that subject now, let's bring into the conversation Health Secretary Matt Hancock, who joins me now. We've been drilling through the figures, Ms Hancock, good morning to you. And I note that women who use a contraceptive pill, there's a 1 in 2,000 chance of a blood clot. Get on an aircraft, it's a 1 in 1,000 chance of getting a blood clot. Given that and the figures, the extraordinarily unlikely chance, God forbid, of this happening with the AstraZeneca, was it necessary to pause? Good morning.
Good morning. How are you?
I'm well, thank you, and I trust you are. I've just seen you on the TV. You look very healthy. As your mother would say, you've got colour in your cheeks at last. You look well.
Well, the sun is shining, Nick, and I was
wouldn't
out
know,
in the
Health
garden.
Secretary. I'm in a studio with no windows. I'm not allowed out until 1000 hours. I've no idea.
I was out in the garden. I've seen some friends in the garden
Good.
over Easter weekend, which was extremely enjoyable,
Well, that's
and
good.
things are looking up.
That's good. But why do we need to press pause on AZ?
Well, we haven't. We haven't. What we've done is we've published all of the data that we have, and we're totally transparent about these extremely rare side effects. And we've said that if you're under 30, then if you want, you can have a different one, a different jab, the Pfizer or the Moderna jab that are now available in the UK. And we've done that because we just want this program to be as safe as it possibly can be. And I think that, the fact that the regulators who monitor this rollout have spotted a 4 in 1 million chance event is impressive, and I'm very grateful to them. And it's better to be totally transparent. I hope people find that reassuring.
But what of someone in this age cohort who's had one initial AZ jab? What is your advice then?
Then they should take the second Oxford AstraZeneca jab, because
but if they have concerns, Health Secretary, what do they do then?
Well, the advice, if you've had one, is to take the second, because there is no evidence of this happening after second jabs. The evidence is only after first jabs, and so that's really clear, because these vaccines are regulated for having two of the same jab. And so that's what people should do, unless they themselves have had one of these extremely rare side effects, in which case they should be talking to their doctor.
All right. We talked in the past about the sensational, world-beating success this country has enjoyed in getting first-dose vaccines out there. Numbers sometimes of 500,000, 600,000 first-dose vaccinations. You'll be aware, Secretary of State, that this week it's been 40-odd thousand, and I think 60 or 70-odd thousand today. Why the drop?
Well, we've obviously got a huge number of second doses going out at the moment. So yesterday there were several 100,000 doses given. I haven't got the exact number in front of me, but
it's 186 second today, just to support what you're saying. So it's 186 second doses today, but only 70-odd thousand first doses. We can't, of course, let the first doses miss out. Of course, those are the first recipients.
That's right, but it's critical that people get their second dose on time. So the second doses are rolling out with increasing pace, increasing number, and then where we have more for first doses, then we're doing them as well. April is the big month for second doses, because we're 12 weeks on from when after we started the program with those huge numbers that we saw in January and February. But we're on track to both meet offer everybody who's 50 and above the jab by the middle of this month, 15th of this month, end of next week, and then also all adults by the end of July.
You have a big piece in The Sun today. Let me quote some of it back to you and to my listeners. We were the first country in the world to not only authorise a vaccine, but to roll it out. We've now given first doses to more than 6 in 10 adults, which has had a huge impact on protecting the most vulnerable. You add, this high take-up is beyond my highest hopes. It's far higher than we planned for. Why then? Why what many people would say, incredibly slow pace of the rollout? Why can that not be increased, expedited?
The incredibly fast pace of the rollout. I mean, it's been unbelievable.
The easing of restrictions. Why can the easing?
Oh, I see.
Why?
I see.
If you'll allow that the first target was to save the NHS.
Yes.
Then it was, if we give up Christmas, we'll have it at Easter, which sadly was not possible. Now we're going to have freedom, but we have to have twice weekly tests. We can't travel overseas. We still have social distancing. This is freedom, is it, Secretary of State?
It is absolutely restoring. Getting life back to normal.
What, taking 2 weekly tests, Mr. Hancock?
Well, that's voluntary, but it's important. Yeah, I do it, and many school children, millions of school children do it, and teachers, and people in the NHS, and people who work in social care, and thousands of companies, because for the effort which takes about 5 minutes ago of taking 2 tests a week, you are helping to spot the virus and break the chains of transmission and keep this down. So, the uptake of the vaccine obviously has been spectacular, over 90% in all
Then why not our recovery matching it? Why are we still going at such a slow pace? Indeed, it's reported we'll have herd immunity next week, and yet still we have to have social distancing. We're meant to, if voluntarily, take 2 tests per week, and we can't travel. Why?
Well, I was told by some scientists that we were going to have herd immunity in May, and then in June, and then after that. And
so these reports are rather exaggerated in your view.
What I prefer to do is watch the data. And so we've set out the roadmap. The roadmap is really clear. It is our route back to normal. We're on track to meet the roadmap, and that is that's our goal. And critically, after we take each step, like on Monday, we're going to be able to go to the pub in the garden, which is going to be
those that are still open, of course. Many have shut, sadly. But why don't you accept modelling from the University College London vis-à-vis herd immunity, but you do, say, from the Imperial College modelling? What makes their modelling? Could I put it to you that they tell the message that you want, and the others don't tell the message that you want to hear, so you ignore it?
Well, the Imperial study out this morning is not modelling. That's data. That's showing.
No. University College modelling says that we will have 73.4% herd immunity by Monday.
Well, I think we have taken the right course in plotting our way to freedom and doing it carefully, because we want it to be irreversible. We have seen what happens when this virus gets going, and we're seeing it getting going right now on the continent, and really, in other parts of the world. I mean, some of the scenes are really appalling, and we want to get out of this safely and irreversibly, and that's why we set out the roadmap.
While you are in the sun today, Lord Sumption, the former Supreme Court judge, has a piece in the Daily Telegraph. He says it's inhuman. We've been left at the mercy of sages' garbage modelling. How do you respond, Secretary of State?
Well, there are. I've seen his comments all the way through, and I think that he's been against all of the necessary measures all the way through. And he's, I think that the evidence has proved the approach that he recommends wrong. So there's
You're not guilty, not you personally, you're not guilty of moving the goalposts, as in, we must save the NHS. If we don't have Christmas, we'll have Easter. Cry freedom, the Prime Minister said in February. I put it to you again, freedom is not sticking a swab up my nose twice a week, is it?
Well, you, Nick, are perfectly free not to stick anything up your nose if you so choose. But I think that it's a totally reasonable step that the vast majority of people think is perfectly fine to be tested. In fact, you will remember urging me to have more testing many months ago. Now we have this
that was
massive
testing the huge
capability
success of the vaccination program.
A combination of the two will make it even safer and save more lives.
We've had our moments in the past. I want to close on an upbeat, because we saw the brilliant JVT in action yesterday, Deputy Chief Medical Officer Jonathan Van Tam, likening it to crossing a liner crossing the Atlantic. If you have a second, 20 seconds or so, just share some of these marvellous previous moments with JVT with me. Mr. Hancock.
So this is like getting to the end of a playoff final. It's gone to penalties. The first player goes up, scores the goal. You haven't won the cup yet. It tells you that the goalkeeper can be beaten. A bit like a football game where the strikers who score the wonder goals are the ones who make the headlines. Actually, the hard yards are done by the defenders and by the defensive midfielders, tracking back for 90 minutes of the whole game. The train has now slowed down safely. It has now stopped in the station. The doors have opened.
And yesterday,
if you sail a massive liner across the Atlantic, then it's not really reasonable that you aren't going to have to make at least one course correction during that voyage.
Secretary of State, how could you sum up the brilliance of JVT in a few words?
He's a wonderful man who knows how to make very complicated things really, really easy to get. He's one of the best scientific communicators on the planet.
Let's be honest, if you could choose someone to be in the beer garden with on Monday, come on, Mr. Hancock, it would be JV. It would be JVT, wouldn't it, Mr. Hancock?
Yeah, we all love JVT. He's a great man.
Thanks for your time, Matt Hancock, Health Secretary, appearing here on LBC, where news is next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, the Health Secretary Matt Hancock says the Oxford AstraZeneca vaccine is safe for all ages. The UK's medicines regulator has changed its guidance to say that the under-30s should now receive alternative COVID-19 jabs. The MHRA concluded there's a possible link between the AZ vaccine and extremely rare